I'm Dr. John Edney. I'm one of 3 plastic surgeons practicing in Omaha, Nebraska at Aesthetic Surgical Images. One of the most common operations we perform in our facility is an abdominoplasty, otherwise known as a tummy tuck. Many times we perform it by itself, but often we perform it in conjunction with other procedures such as breast surgery and liposuction in a combination otherwise known as the mommy makeover. Now, the abdominoplasty is a complex operation that many patients don't quite understand when we just describe it to them. So over the years, we've found out that it's easier to draw them a diagram and to demonstrate the differences between a full abdominoplasty and a so-called mini tummy tuck or mini abdominoplasty. We find that just using exam table paper and diagrams are very helpful in demonstrating the differences and getting a better understanding of the procedure. And so when we see a new patient for this procedure, we'll take the exam table paper and use it with a series of cutouts to demonstrate the differences between a full abdominoplasty and a so-called mini abdominoplasty. So if we start off with the paper folded on itself like this, we first of all draw the diagram of the patient. And this would be the chest area up here, and the hip area down here, the rib cage margin, and the belly button. Now, when we're performing a tummy tuck, the first thing we want to do is decide how low to make the incision. We commonly ask the patients to bring in the briefest article of clothing they're going to wear outside, which is normally the bottom of a 2-piece bathing suit or a bikini. If the patient brings that in, we can better orient the incision to make sure when we're done, it has a better chance of being in conformance with the type of clothing they want to wear. But let's say this is the bottom incision where we're going to make the initial cut. The initial incision for a tummy tuck is through the skin and fat, in the skin and fat layer. And once we make that incision, we then lift the skin and fat layer off of the underlying muscle layer up until we get to the belly button. When we get to the belly button, we don't want to cut through the stalk of the belly button, or else we would damage it. So we cut around the belly button in such a way as to release it from the skin, and then continue lifting the skin off of the muscle layer up to the rib cage. Now, once we're at this layer, we then look at the muscle layer and decide if it needs some tightening. And very commonly after childbearing, there'll be some need to tighten up the muscle layer. The muscle that we're going to tighten, the muscle layer we're going to tighten are the juncture of the 2 rectus muscles. These are the muscles that run up and down in the center part of the abdomen. And very commonly, a woman can benefit with tightening of this muscle either by individual stitches or one long continuous stitch to tighten this up, because many times there's some degree of separation of those 2. Once we're done with the tightening, then we take the skin and fat layer and pull it down as snug as we can and remove the excess. Ideally, we'd like to have the hole that we created to release the belly button come down and come past the area that we're going to throw away, so we get rid of that hole. Sometimes, however, there's not enough laxity of the skin to pull it all the way down, and it might end up somewhere between where we want to make our incision to discard the tissue and where the previous belly button was. In that case, we get to throw away this tissue. We'll make a cut here and bring the belly button back out so it's at the same level as it was before, but we have to close this here. This sometimes leads to a small incision up and down somewhere between the belly button and the lower abdominal incision. Before we close this incision down here, we normally place drainage tubes to allow for the fluid that would normally collect between these two surfaces to go away. This is a raw surface, as is this, and as they lay against each other, it's important that they heal properly without fluid in between. And so commonly there's drainage tubes down here. Some surgeons may elect not to use drainage tubes. We normally put them in. Once the operation is over, it's pretty clear that this is not attached to this. It's going to take a few weeks for this healing to take place. And during that time, it's important to follow your surgeon's instructions so there's not too much activity that might disrupt that healing process. Some patients may not require a full tummy tuck, and they might do well enough with just a mini tummy tuck. The big difference between the two is the amount of release we have between the skin and fat layer and the muscle layer, and the amount of skin that's removed. In a mini tummy tuck, we're not going to be tightening any of the tissue above the belly button. We're not going to cut around the belly button. What we're going to do first is very likely liposuction this whole area first, and then lift up the skin and fat layer until we get to the belly button. We're very likely not going to be able to perform any type of muscle tightening, but we'll take the extra skin and pull it down. Commonly, the amount of skin that we would take out would be something along this line here. So the mini tummy tuck is good for the patient who may have some extra fat through here, a small amount of excess skin between the belly button and the pubic bone, but otherwise satisfactory contouring in the upper part of the abdomen. The recovery for this one would be somewhat shorter than a full abdominoplasty because there's less disruption of the underlying tissue. Well, thanks for watching. If you have any other questions regarding this procedure or any other procedure, feel free to contact us through our website, which is surgicalimages.com. Thank you.